Hello everyone, I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I am here to take a very important series, that is Mnemonics Marathon. So I am going to teach you very important, interesting mnemonics in pathology also, and in the next lecture we will continue with pharmacology also. Now these mnemonics will help you in your exam with multiple to crack multiple MCQs. Now in our medical subjects, all 19 subjects, there are two types of knowledge. One is conceptual, one is factual. So the conceptual one is the one that you have to understand, that you don't have to mug up. So I give you flowcharts, images to understand the concepts. But there are certain things, there are lists of some drugs, some things, so that's some examples that you have to mug up. You don't have to understand. That is factual knowledge. So for factual knowledge or such lists, to simplify those, I have make many mnemonics for you. So today I am going to share those mnemonics with you, and not only with the I will show you the mnemonics, I will share the mnemonics. Even after each and every mnemonic, I will show you the previous year question papers based on that mnemonic, so that it will be easy for you how to apply that mnemonic in the question. So without wasting time, let me start. So let me continue mnemonic marathon. Let me start with pathology first. So okay, the first mnemonic is of hypersensitivity. You can see here hypersensitivity. So we know we have four types of hypersensitivity. Now the question comes from the examples of hypersensitivity. Students always get confused that what is an example of which hypersensitivity. Just for example, Cassoni test is an example of which hypersensitivity. Tuberculin test, Lepramin test, example of which hypersensitivity. Is it type 1, 2, 3, 4? Putzner reaction, Thibaut-Smith phenomenon. So all these, blood transfusion reaction, myasthenia gravis, Graves disease, all these are example of one of the four hypersensitivity. But how to learn them? How to learn them? So don't worry, I am having mnemonics for it. So let me start with type 1. There are four types of hypersensitivity. So I am going to give you four mnemonics one by one. So let me start with the first one. The first one is type 1 hypersensitivity. As we all know that type 1 hypersensitivities are allergies. They are allergies. We don't have to learn the name of the allergies. Now, we know that asthma is allergy. We know that atopic reaction is the allergy. We know acute dermatitis is the allergy. Hay fever is allergy. So don't learn the name of the allergies. But apart from allergies, what are the examples of type 1? So I am giving you a mnemonic for that. The mnemonic is PCT. The mnemonic is PCT. What is the full form of PCT? Here you can see the full form of PCT. P is Putzner reaction. It is PK. It is a previous year question. C is Cassoni test, and T is Thibaut-Smith phenomenon. So PCT is the mnemonic of type 1 hypersensitivity along with allergies. You already know asthma, hay fever, atopic dermatitis. So along with the allergies, learn the mnemonic PCT. Let me quickly come on the mnemonic for type 2 hypersensitivity. For type 2 hypersensitivity, the mnemonic is my blood group is Rh positive. What is the full form of it? So here M stands for myasthenia gravis. It is a repeat PYQ, multiple time it is asked. Blood stands for blood transfusion reaction. This is just suppose there is a patient with blood group A, and by mistake someone have transfused blood group B inside patient of blood group A. So it is a blood transfusion, it is a mismatch reaction. So it is an example of type 2 hypersensitivity. G stands for two things. Both are previous year question. G for good pasture reaction and G for Graves disease. You know what are good pasture syndrome and Graves disease. I again stands for two things. Main is ITP. You know what is immunothrombopenic purpura. Immunocytogenic thrombopenic purpura, and I is insulin resistant diabetes also. R is rheumatic fever. You know what is rheumatic fever. H is hyperacute graft rejection. There are three types of graft rejection: hyperacute, acute, and chronic. Out of the three, hyperacute one is type 2, and the remaining two, that is acute and chronic, are example of type 4. Right? P stands again for two things: pernicious anemia and pemphigus vulgaris. So my blood group is Rh positive. So that is the thing I must tell you for type 2. Let me come on type 3. So for type 3 also I am having a mnemonic for you. The mnemonic is SHARP, sharp. The mnemonic is sharp. So here S stands for three things. Let me show you the full form. What does S stands for? The S stands for, just a second. So here S stands for three things, triple S. One S is serum sickness, One S is Sheik test, one S is SLE. So these are the three S you must know. H stands for HS purpura, HS purpura. A stands for arthrous reaction. R stands for reactive arthritis and Raji SA. And P again stands for two most important things. That is polyarthritis nodosa PAN and PSGN, post streptococcal glomerulonephritis. Many of them are previous year question paper, already questions in the previous year questions, and you never know the new question can be created from any of them. These are the important examples of type 3. The last important examples of type 4. Let me come on important examples of type 4. Right. In type 4, you can see type 4, the mnemonic. I am having a mnemonic. The mnemonic is John gave tulip and popcorn to Hershey. Make it Hershey, right? So John gave tulip popcorn to Hershey. So John, from John you can learn like John motor reaction. Just a second. From John, the John stands for John motor reaction. Tulip mein there are two things, T and L. So tu is tuberculin and lip ka L is lepramin. So tuberculin and lepramin, you all know that these are the examples of type 4 hypersensitivity. Pop and corn, again two things are there. So here P stands for pernicious anemia and C stands for contact dermatitis. And last Hershey is Hashimoto thyroiditis. So these are the important reactions, the important examples. Apart from it, you all know chronic granuloma. You can make Gave ka granuloma. Chronic granulomas are also examples of type 4. So let me summarize. So I will launch many questions in front of you. Contact dermatitis is type 4 Vibhuti. It is not type 1, it is type 4. Yes, you are right. Here you can see it is contact dermatitis. So let me summarize. Okay. I will write the summary in front of you. So type 1, let me write down. Just a second. Okay, we will write here. Just a second. So it is type 1 hypersensitivity, type 2 hypersensitivity, type 3 hypersensitivity, and type 4 hypersensitivity. Would someone like to help me with the mnemonics? Can you write down in the chat box? Anyone? Vibhuti, Lavanya, Parag. So type 1 is all allergies along with PCT. You already know the full forms of PCT. It's Putzner reaction. It is Cassoni test. C is not contact dermatitis. It is Cassoni and Thies-Theobald-Smith phenomenon. Right. In type 2, my blood group is RH positive. Can you say the full form? M stands for myasthenia gravis. B stands for blood transfusion reactions. G, it stands for two important things. What does it stand for? G stands for Goodpasture syndrome, as well as it stands for Graves' disease. I stands for ITP. Again, two things. Number 1, ITP. Number 2, insulin resistant diabetes. Right. R stands for reactive arthritis. H is hyperacute graft rejection. The remaining two graft rejection, acute and chronic, are examples of type 4, not type 2. Right. P is pernicious anemia and pemphigus vulgaris, you can say. Type 3, the mnemonic is SHARP. SHARP. You know, S stands for three important things. SLE, serum sickness, and what is the third one? I just forgot. What is the third one? The third is SLE, serum sickness, and Sheik test. The Sheik test, which is performed in diphtheria, right? So you can say the full form by yourself. In this manner, you have to learn. H is HS purpura, A is arthrous reaction, R is reactive arthritis, P stands for two important things here. Polyarthritis nodosa PAN and PSGN, post streptococcal glomerulonephritis. The last and not least, the fourth, type 4, hypersensitivity. The mnemonic is John gave tulip popcorn to Hershey. Say the full form again. It is John gave tulip ka T and L, popcorn ka P and C, and Hershey. You can see. So what is the full form? So John motor reaction. G say granulomatous reactions, all chronic granulomatous reaction. Tuberculin test, lepramin test. Tuberculin test and lepramin test. And it is contact dermatitis. It is pemphigus vulgaris and Hashimoto thyroiditis. Everyone give me a thumbs up. Jitne audience, utni thumbs up. Now we will do some questions based on that. And you have to write your answer in the chat box. I can see your chat. You have to tell me what is the correct answer. So this is the first question in front of you. You can see the 4 options. Let me read the question for you. Putzner reaction is an example of which type of hypersensitivity? Is it type 1, type 2, type 3, type 4? Apply the mnemonic. Who will tell me the correct answer? So Vibhuti, Parag, absolutely right. What about others? Lavanya, you are also right. What about others? Yes. Apply the mnemonic. The correct answer is type 1. What is the mnemonic of type 1? The mnemonic of type 1 is PCT. So here P stands for Putzner-Kutzner reaction. P stands for Putzner-Kutzner reaction. You can see here. So the correct answer is type 1 and you all are right. Yes, Anu, Lavanya, Harampreet, you all are right. Very good, very good. The correct answer here is A, right? Coming on the next question. The next question is in front of you. Which of the following is false? See all the pairs. You can see the multiple pairs here. Tell me which pair is false. Tell me which pair is false. Read the pairs. I'm giving you time. So tell me what is the correct answer. Okay, let me read for you. Theobald-Smith phenomenon. Is it type 1? Is it correct or false? Serum sickness. Is it type 2? Is it correct or false? Allograft rejection. Is it type 4? Correct or false? And blood transfusion reaction. Is it type 2? Correct or false? Who will tell me? Parag is the first one to tell me the correct answer. Absolutely right, Parag. What about others? Would others also like to tell me the correct answer? What is the correct answer? Tell me the false pair. So here examples along with the hypersensitivity is given to you. So everyone is right. Very good, Anu, Vijay, Yogesh. Very, very good. Very good. So all of you are right. The correct answer here is B. You know, just a second. So correct answer here is B. So serum sickness is not an example of type 2. Serum sickness is an example of type 3. That's why this is false. So the mnemonic is SHARP, S-H-A-R-P, the type 3 mnemonic. So S stands for three things. One of the three things is serum sickness. SLE, serum sickness and Sheik test. ये तीनों S type 3 में है. So serum sickness is not type 2. The rest of the pairs are correct. So most of you are right. The correct answer here is B. It is not C, Anu. Anu, it is not C. It is B. You got my point? Give me a thumbs up. Coming on the next question. You can see this. Serum sickness is an example of type 3. That is SHARP. So correct answer here is B. You all are right. You all are right. So this is the next question in front of you. Who will tell me the correct answer? I want to see who is the first one. So, okay. Example of type 1. Yes, morning medicos. You are first to answer. What about others? Which of the following is an example of type 1? You can read the options. Is it lepramin? Is it tuberculin? Is it Cassoni? Or is it arthros reaction? So, can all of you tell me the correct answer? So, Parag, Lavanya, Anu, Vibhuti. Again, you all are right. Very good. The correct answer here is Cassoni test. Okay. So, lepramin test is an example of type 4. Right? John gave tulip. Tulip ka L is lepramin. Tulip ka T is type 4 में again tuberculin. So these two are an example of type 2 and arthros is an example of type 3. Sharp, S-H-A-R-P का A है. So it is type 3. But Cassoni is type 1. PCT का C है. In PCT it is C. So you should know about other options also. You should know about other options also. Everyone. Yes, Vibhuti, absolutely right. Yes, so everyone is right. I guess I should move further. So this is how you have to apply the mnemonics for solving the question. The mnemonics are very useful for you. These are your weapons, you know, to fight, right? Exam is like a war. You have to fight and you have to win. So you require weapons without which you cannot win, right? So the mnemonics are very useful for you. So correct answer here is C. You all are right. This is the next question in front of you. Myasthenia gravis is an example of which type of hypersensitivity? Apply the mnemonics and tell me the correct answer. Is it type 1, 2, 3 or 4? This question is repeated in multiple exams and previous year question papers. You will find this question. So it is a favorite question of the examiner. So yes, Parag, Lavanya, Vipul, you all are right. What is the correct answer? No, Lavanya, it is not D. Yes, the correct answer here is type 2. My blood group is Rh positive ka my. M stands for myasthenia gravis. So the correct answer here is type 2. Correct answer here is B. It is not D. Some of you are saying D. D is not the correct answer. Why you are saying D? D ka mnemonic apply karo. Type 4 ka what is the mnemonic? John gave tulip and popcorn to Hershey. So where myasthenia gravis is coming? Myasthenia gravis is not coming in type 4. It is coming in the mnemonic of type 2. My blood group is Rh positive. You can see my ka jo M hai, it stands for myasthenia gravis. My blood group is Rh positive. So the best thing is to say these mnemonics and learn these mnemonics, the full form of these mnemonics. So today, your best friend, your batchmate, your senior, your junior, किसी को भी पकड़ लो and write all these mnemonics and say these mnemonics in front of someone. I'm teaching you now. So you teach someone. Once you teach someone, you say these in front of someone, you will never forget. It will fit in your permanent memory. So try this formula, right? Try this funda. Coming on the next question. These all are previous year questions. These are not the new questions which are already asked in your various exams, the previous year papers. So Graves' disease is an example of which type of hypersensitivity? Can you tell me the correct answer? The four options are in front of you. Can you tell me the correct answer? You already answered. Very good. Anu, Lavanya, morning medicos. So the correct answer here is type 2. So the mnemonic is my blood group. Group का जो G है, it stands for two things. Graves disease and good pasture syndrome. So दोनों पे PYQ है. Graves पे भी good pasture पे भी. Answer is type 2. My blood group is RH positive. So my blood group, here group, my blood group का group stands for two things, good pasture syndrome and Graves disease. So here the examiner is asking about the Graves disease. That's why the correct answer here is type 2. You got my point? Let me move to the next question. The next question is in front of you. The hypersensitivity reaction which is involved in hyperacute graft rejection. I am asking about hyperacute. As I have told you, there are three types of graft rejection: hyperacute, acute and chronic. Depend on the time, after how much time they are rejected in the body. Hyperacute graft rejection is one graft rejection which is the graft is rejected on the OT table only. So you can imagine the two OTs are running simultaneously. In one OT there is a donor, in another OT there is a recipient. We prefer to conduct both the OTs in the same hospital. So as soon as the graft, that organ, the graft coming out of donor body, we implant it in the recipient's body so that there is no autolysis in the graft. So this is the funda. So as soon as the graft is coming out of donor body, and the recipient body, the surgeon's team, as soon as implanting the graft in the recipient body, the graft is rejected on OT table only. So if it is renal graft, the kidney will turn acute, red, hot, congested. So it is the hyperacute rejection. It is due to preformed antibodies. It is due to humoral immunity. So that recipient already have antibodies for the graft which is implanted, right? Already antibodies hain. So these are the preformed antibodies which reject the graft instantaneously. That is known as hyperacute. Within few minutes, the graft is rejected. The surgeon can see it with naked eye. The second type of rejection is acute. In acute rejection, the graft is rejected within 6 months of the surgery, within 6 months of the transplant. And in chronic, it is more than 6 months. So acute and chronic are not due to humoral immunity. So humoral immunity will take a part in that, but it is not the only humoral immunity. Cell-mediated immunity will be predominant role in acute and chronic, right? So in hyperacute, it is the humoral immunity. So that is the general knowledge about the grafts I am telling you. I am asking about the type. Hyperacute graft rejection is a type. Which type? Which type of hypersensitivity? So most of you are right. The correct answer here is type 2. The correct answer here is type 2. I told you the mnemonic. My blood group is RH. RH का H क्या है in the mnemonic? RH का H is hyperacute graft rejection. This is RH. Can you see? My blood group is RH positive. So RH का जो H है, it is hyperacute graft rejection. Give me a thumbs up. It is hyperacute graft rejection, and I'm changing this question now. You tell me what is the answer if I change the question. So instead of hyperacute, in the question, I'm asking acute graft rejection. What is your answer now? From the same four options, A, B, C, D, what is your answer now? Osama, Yogesh, Aniru, Anu, who will tell me the correct answer? I'm changing the question. Instead of hyperacute, I'm asking for acute. Now tell me the correct answer. So correct answer, yes, very good, Parag. In that case, the correct answer will be type 4. It is not type 2. So my point is that hyperacute is type 2. Remaining all graft rejections are type 4. Whether it is acute, whether it is chronic, or whether it is GVHD. These are the types of HVGD. There are two types, na, HVGD and GVHD. So or kuch bhi, all of them are types of type 4. But only hyperacute is type 2 because which is different from others. In that it is the rejection is due to preformed antibodies. Okay, let me move ahead. So you can see the next question, a very easy question. Contact dermatitis is an example of which hypersensitivity? Apply the mnemonics. I've told you 4 mnemonics. Apply all 4. See, C kahan pe aa raha hai? So is it PCT ka C? Type 1 ka mnemonic PCT ka C. Is it that? Is it that? No. Or John give popcorn. Popcorn ka C. Yes, it is popcorn ka C. So most of you are right. The correct answer here is type 4. Very good. The correct answer here is type 4. Very good. So C is coming at multiple places. C is coming in PCT also, but that C is Kasoni. So knowing mnemonic is not important. Knowing the full form of mnemonic is more important. You got my point. And type 4 ka mnemonic you already know. John give tulip. Tulip and popcorn. Popcorn ka C is contact dermatitis. So you all are right. The correct answer here is type 4. Right? So this is how you can see this mnemonics are useful in solving many questions in with very easy, right? With very ease, right? You can apply these mnemonics in the questions. I have given you all the previous year question papers, from the previous year question papers, all the questions based on these mnemonics. Let me come on the next mnemonic. So the next mnemonic is genetic inheritance. In FMG, every year, one question is fixed from this topic. So there are 5 types of genetic inheritance we already know: autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive, and mitochondrial inheritance. We know that in human cells, the diploid cells, there are, we can say, either 46 chromosomes or 23 pairs of chromosome. Can I say 23 pairs? So in 23 pairs, the 22 pairs are, you can say, these are pair number 1, pair number 2, pair number 3. Likewise, we have 22 pairs. So these are the numbered chromosomes. These are not sex chromosome. And the last pair is sex chromosome, in which if the male is there, it is XY, and if the female is there, it is XX. We already know the basics. So if the inheritance occurs in these not sex chromosomes, if the inheritance is occurred in sex chromosomes, it is X-linked dominant and X-linked recessive. And it is not occurring in sex chromosome, other chromosomes it is occurring. It is autosomal dominant and recessive. What is mitochondrial inheritance? Mitochondrial inheritance में क्या होता है? The disease is transmitted from mother to children. By children, I mean both son and daughter. So only mother can transmit the disease. Father cannot transmit the disease. You should know the pedigrees of all. By the way, in the next week, I am taking a special lecture on pedigree analysis. Pedigree analysis question is a difficult level question in which a pedigree will be given to you. Looking at the image, it is an image-based question. So you know what is pedigree. I guess everyone knows. So in the pedigree, you have to see that the disease is transmitted in every generation or there is a skip. The first thing you have to notice. The second thing you have to notice, who's transmitting the disease, the mother or father. If the mother is transmitting to whom? Sons or daughters? And if the father is transmitting to whom? Is it sons or daughters? Or it is not related to the sex? Mother, father, both are transmitting. So based on that, you have to come what is your correct answer out of the five type of patterns. You got my point? Pedigree analysis is it is a level of excellence. If you know the genetics very well, then you can solve the questions on pedigree analysis. So next week, I'm taking a 1-hour lecture on pedigree analysis, in which I will show you the pedigrees, multiple pedigrees of all these 5 inheritance. But currently, I'm giving you the mnemonics of examples of these inheritance, and after giving 5 mnemonics, the 5 inheritance, 5 mnemonics, I will show you the previous year question papers in which many of these questions are asked, and many of these questions are asked, and you can apply these mnemonics for solving those questions. Let me start with autosomal dominance, the first mnemonic. So the first mnemonic is in front of you. Autosomal dominant. The mnemonic is dominant itself. The mnemonic is dominant in itself. D-O-M-I-N-A-N-T. You can see the mnemonic is dominant itself. So here D stands for dystrophic myotonic. Just a second. D stands for dystrophy. Dystrophy. Which dystrophy? All other dystrophies will come in X-linked recessive, but only this dystrophy, myotonic dystrophy, is coming in here. That is autosomal dominant. But other dystrophies will come in X-linked recessive. I will tell you there. Right? O stands for osteogenesis imperfecta. M stands for Marfan. I stands for intermittent porphyria. N stands for Noonan syndrome. A stands for ADPKD. You know, PKD are of 2 types. The PKD are of 2 types. The adult one, the infantile one. The adult one is autosomal dominant. The infantile one is autosomal recessive. And A also stands for achondroplasia. N stands for neurofibromatosis. There are 2 types of neurofibromatosis type 1 and 2, and both are examples of autosomal dominant. And T stands for tuberous sclerosis. In sub pe PYQ hai. Now I will launch polls. You yourself will realize how this mnemonic is important for you. So please learn this mnemonic, note it down somewhere so that you can solve the questions, apply this mnemonic. Coming on the next mnemonic, autosomal recessive. Autosomal recessive ka mnemonic, I'm sorry, it is in front of you. Just a second. Autosomal recessive ka mnemonic is in front of you. The mnemonic is ABCDEFGHSPW. So here A stands for 2 things, albinism and antitrypsin deficiency. Albinism pe previous year question paper hai. B stands for beta thalassemia. It is a type of hemolytic anemia. And here S stands for sickle cell anemia. It is also a type of hemolytic anemia. So out of many types of hemolytic anemia, 2 are coming here. Beta thalassemia and sickle cell anemia both are having autosomal recessive traits. You have to learn it. C stands for cystic fibrosis. Again, it is a previous year question paper. C for cystic fibrosis. D for deafness. D standing for deafness, that is sensory neural hearing loss. And D also stands for Dubin-Johnson. E for enzyme deficiencies. It is lysosomal and glycogen enzyme deficiencies. F stands for Friedreich ataxia and Fanconi. Fanconi पे previous year question paper है. G stands for galactosemia. G for galactosemia. S I have already told you it is sickle cell anemia. P for phenylketonuria and W for Wilson. Wilson पे भी PYQ है. Now इस पे बहुत सारे पे already PYQ है and the remaining one you never know, new question can be created on any of them, right? So please learn. H I have left, it is H, hematochromatoses and Hurler syndrome. So please say the full form A, B, C, D, E, F, G, H, S, P, W. So 4 plus 3. So these are the, say the full form of A, B, C, D, E, F, G, H, S, P, W. Then you can utilize this mnemonic for solving question. I will give you the questions also, don't worry. So let me come on the third mnemonic. X-linked dominant. X-linked dominant के only 4 important diseases are there. FAIR, the mnemonic is F-A-I-R. FAIR is the mnemonic. So FAIR stands for facio-oral syndrome. A is Alport. Those who have solved previous year question paper, they already know Alport is repeated how many times in PYQs. Alport is very, very important, right? I is incontinenta pigmentosa. I, and इस पे भी PYQ है. And R is resistant rickets, right? So इसमें से दो ही important है, A and I. So F-A-I-R, FAIR is the mnemonic. The last one, that is X-linked recessive. इस पे बहुत questions आते हैं. It is very, very important. The mnemonic is Graham-Bell. G-R-A-H-A-M-B-E-L-L. So G-R-A-H-A-M-B-E-L-L में G stands for G6PD deficiency. R stands for retinitis pigmentosa. A stands for androgen sensitivity. H for hemophilia. Hemophilia A as well as hemophilia B. You know Christmas disease. So hemophilia A and B and hydrocephalus both are examples of H here. That is X-linked recessive. A is adrenoleukodystrophy. Adrenoleukodystrophy. M is Menkes disease. B and E are the remaining dystrophy. I have told you only main dystrophy, that is myotonic dystrophy, is autosomal dominant. Rest all dystrophies are X-linked recessive. I have told you now. So C, B is Baker dystrophy, Duchenne dystrophy, and E is Emery-Dreifuss dystrophy. So the remaining 3 dystrophies are example of X-linked recessive, not dominant. That was autosomal dominant, right? B is color blindness. B for blindness bhi hai. It is a last year FMG question. If you have solved FMG papers, it is the last year, the most recent one, FMG paper. L is Lesch-Nyhan syndrome and one L is Lowe. There are 2 L, na? B-E-L-L. So 2 L mein 1 L is Lesch-Nyhan and other L is Lowe. So ye hua mnemonic. So the last one is mitochondrial inheritance. So what is mitochondrial inheritance? The mnemonic is KLMNOP. In alphabets ABCD, they come together. KLMNOP. So K stands for Kearns-Sayre syndrome. Kearns-Sayre syndrome. L is Leber. Leber पे PYQ है. Leber hereditary optic neuropathy. M stands for MELAS. Do you know the full form of MELAS? MELAS is mitochondrial encephalopathy with lactic acidosis and stroke-like syndrome. So that is the full form of MELAS. N stands for NARP. You know the full form of NARP? It is neurogenic ataxia with retinitis pigmentosa. O stands for ophthalmoplegia and P for Pearson syndrome. Question PYQs on labor and on Pearson. The 2 PYQs which are already asked in the previous year question papers. Now let's apply this mnemonic. Let's apply this mnemonic. I will launch few questions. You have to apply these mnemonics and tell me the correct answer. Tell me the correct answer, right? Okay. Before that, we will revise the mnemonic. So what is the mnemonic for autosomal dominant? Can anyone of you want to help me? The mnemonic is dominant itself. D-O-M-I-N-A-N-T. N-A-N-T. So this is the mnemonic. What is the mnemonic for autosomal recessive? It is A, B, C, D, E, F, G, H, S, P, W. I guess you know the full form. What is the mnemonic for X-linked dominant? The mnemonic is FAIR. F-A-I-R. And X-linked recessive, the mnemonic is Graham-Bell. G-R-A-H-A-M-B-E-L-L. Right? And mitochondrial inheritance, the mnemonic is KLMNOP. K-L-M-N-O-P. So these are the, I am not saying the full form, it will take time, but I guess every one of you knows the full form. Now apply, please apply these mnemonics. Say the full form and apply these mnemonics here. So this is the first question in front of you. This is the first question. You tell me the correct answer. Inheritance in myotonic dystrophy is which one? Is it autosomal recessive, autosomal dominant, X-linked dominant, X-linked recessive? So the 4 mnemonics are in front of you. These are the 4 mnemonics. Where this is coming? This disease is coming where? Myotonic dystrophy is coming in which mnemonic? Who will tell me the correct answer? Who will tell me the correct answer? Myotonic dystrophy is coming in which mnemonic? Yes, Lavanya, absolutely right. Yes, Parag. Yes, Aniru. So, where it is coming? Where it is coming? Osama, is it A or B? Many students are saying A, many are saying B. What is the correct answer? What is the correct answer? I'm asking about myotonic dystrophy. I told you only one dystrophy. The myotonic dystrophy is this one. This D, dominant ka D is myotonic dystrophy. So the correct answer is autosomal dominant. The remaining all dystrophies, that is Baker dystrophy, Duchenne dystrophy, Emery dystrophy. So all other dystrophies are X-linked recessive, right? But the myotonic dystrophy is an example of autosomal dominant. So go with autosomal dominant boldly, frankly, and confidently go with autosomal dominant. So the correct answer here is B, and it is a PYQ. If I change the question, instead of myotonic dystrophy, I ask any other dystrophy. May I ask Baker dystrophy? Can I ask Duchenne dystrophy? Can I ask Emery? What is the Emery? That dystrophy. So the answer will change. In that case, your answer will become D. But A is no way. A to koi bhi answer hai nahi, right? So the correct answer here is B. So many of you, Osama, Lavanya, Parag, Poonam, very good. Vibhuti, Vijay. So correct answer here is B. Very, very good. Very good. Correct answer here is B. So you have to apply the mnemonic and see dominant ka D is dystrophy. The main dystrophy, myotonic dystrophy. Let me come on the second question. You can see the second question is in front of you. Tell me the correct answer. Tell me the type of inheritance in tuberous sclerosis. So apply the mnemonic. Tuberous sclerosis is coming in which mnemonic? Is it coming in dominant? Is it coming in A, B, C, D, E, F, G, H, S, P, W? Is it coming in Fair? Or is it coming in Graham-Bell? Or is it coming in KLMNOP? You have 5 mnemonics. Where is tuberous sclerosis? So dominant ka T is tuberous sclerosis. So yes, most of you are right. The correct answer here is autosomal dominant only. So you can see dominant ka T is tuberous sclerosis. So in this mnemonic question already asked on myotonic dystrophy, the question is already asked on tuberous sclerosis. These are your previous year question papers, right? So the correct answer here is autosomal dominant. Now in other mnemonic, apply all 5 mnemonics. What are the mnemonics? Dominant mein T is coming. So yes, T is tuberous sclerosis. The second mnemonic is A, B, C, D, E, F, G, H, S, P, W. There is no T. No, it is not the answer. The third mnemonic is Fair, F-A-I-R. There is no T. And the last mnemonic is Graham-Bell. Isme there is no T. KLMNOP, there is no T, right? So T is coming only in one mnemonic, autosomal dominant. So there is no confusion at all. The correct answer here is A. I guess everyone hits the correct answer. The correct answer here is A. Coming on the next question. The next question is in front of you. You tell me what is the correct answer. So which of the following has autosomal inheritance? I'm not saying dominant and recessive. So consider both. I want to ask autosomal inheritance. It should not be sex linked. It should not be X linked. So any autosomal will work. It can be dominant, it can be recessive, but it should be autosomal. It should not be X linked. So out of the 5 mnemonic, apply the first 2 mnemonic. Autosomal dominant also you apply. Autosomal recessive you also apply. Any of the autosomal will work for this question, because the examiner have not mentioned is it dominant or recessive. What you will say in this? Is it hemophilia? No, hemophilia comes in Graham-Bell ka H. Graham-Bell is X-linked recessive. So this one is X-linked recessive, right? And gout, and these are also, gout is not related to the inheritance at all. CHD is also not autosomal. So the correct answer here, you all are right, Marfan. So Marfan, you all are right. Poonam, Aditi, Soumya, very good, Parag, Ashish. So all of you, can you tell me which autosomal is it? What are the 2 options you are having? Marfan is autosomal, I agree. You all are right. But is it autosomal dominant or recessive? You tell me that. So you tell me, is it autosomal dominant or recessive? Apply the 2 mnemonics. Where M is coming? So M is coming in dominant. Dominant M is Marfan. So very good, Parag. It is autosomal dominant. It is not autosomal recessive. Very good. It is not coming in A, B, C, D, E, F, G, H, S, P, W. There is no M in that. So the correct answer here is B. This is how the mnemonics will be useful for you. The next question is in front of you. Neurofibromatosis type 1. Now please mind, I am asking type 1. I am not asking type 2. You tell me what is the correct answer. For neurofibromatosis type 1, who will tell me the correct answer? Anyone want to try? Apply the mnemonics. I have given you the weapons. So please apply them. Please apply them. Use them. Use them judiciously. So what is the correct answer here? So someone is saying B. Remaining are saying A. Someone is saying D. What is the correct answer? What is the correct answer? So neurofibromatosis dominant ka N. Dominant. The dominant is the mnemonic for autosomal dominant. D-O-M-I-N-A-N-T. There are 2 N. N. One N is neurofibromatosis, one N is Noonan syndrome. So neurofibromatosis both type 1 and type 2 comes here. So examiner just confusing you by saying 1. So you will get confused. Oh my God, examiner is asking 1. What about the 2? So you will get confused. So whether the question is 1 or whether the question is 2, if it is neurofibromatosis, answer has to be autosomal dominant. So the correct answer here is autosomal dominant, and you all are right. Very good, very good. You got my point. So in this mnemonic dominant, D-O-M-I-N-A-N-T, this is the mnemonic for autosomal dominant trait. All these diseases follow autosomal dominant trait. You may have seen till now question, previous year question already asked in myotonic dystrophy, previous year question already asked on tuberous sclerosis, previous year questions already asked on neurofibromatosis, previous year question already asked on Marfan. So you can see how useful this mnemonic is going to be for you. Let me move ahead, don't worry. The next question is inheritance in Wilson. You tell me where W is coming. Wilson is W. In which mnemonic W is coming? Apply all 4, 5 mnemonics, whatever I have given you. Apply all 5 mnemonics. Who will tell me the correct answer now? Who will tell me what is the type of inheritance in Wilson? Who will tell me? Is it autosomal dominant, recessive, X-linked dominant, X-linked recessive? Yes. So the correct answer here is B. Most of you are right. The mnemonic is ABCD, ABCDEFGH. I guess you know the full form. If you don't know, read it again and again. SPW. What is W here? SPW. ABCDEFGH, SPW. W is Wilson. So that's why it is Wilson. Correct answer here is, you can see ABCDEFGH, SPW. So this W, this is Wilson. So these all are autosomal recessive. So the correct answer here in this question is autosomal recessive. B is the correct answer. And most of you are right. You got my point? Most of you are right. Coming to the next question. Which of the following is the X-linked recessive? I'm asking X-linked recessive. So what is the mnemonic? First apply the mnemonic. The mnemonic is Graham Bell. G-R-A-H-A-M. Graham. B-E-L-L. Bell. Apply this mnemonic and have a look on 4 options one by one. The 4 options are in front of you. What are the 4 options? Is it G6PD deficiency? What is this G? Is this G is G6PD deficiency? Yes. Yes, you all are right. That's why the correct answer here is A. But N is not coming. Neurofibromatosis, there is no N here. And N, if you ask me, it is autosomal dominant. It is autosomal dominant. Thalassemia, beta thalassemia, where it comes? Beta thalassemia. Beta thalassemia ABCDEFGH SPW का B है. So it is autosomal recessive. It is autosomal recessive. And this alkaptonuria is also autosomal recessive. So X-linked recessive is only one, G6PD deficiency. Graham Bell का G है ये. So you can see here, this is G of Graham Bell. You can see this is G of Graham Bell. It is, you should know the full form of Graham Bell. So it is G6PD deficiency. The correct answer here is A. Let me move on the next question. The next question is in front of you. Hemophilia is associated with which chromosome? I guess it is a baby question and everyone knows the answer. So hemophilia is associated. So hemophilia, where it is coming in which mnemonic? It is coming in X-linked recessive. What is the mnemonic of X-linked recessive? What is the mnemonic of X-linked recessive? It is Graham Bell. Graham Bell का H है ये. You can see in the mnemonic Graham Bell ka H is hemophilia. Hemophilia A as well as B. Both hemophilias are example of X-linked recessive. So of course the answer is X-linked recessive. So it is not associated with any chromosome. Chromosome number kuch bhi de do, it is not associated. It is associated with sex-linked chromosome, X-linked chromosome. And if you ask me further, is it ma'am X-linked dominant or recessive? So my answer is X-linked recessive. To be precise, it is X-linked, but dominant or recessive? So answer is recessive, not dominant, right? So better will be the question if 2 options will be X-linked dominant and X-linked recessive. So everyone knows hemophilia is X-linked associated, but you know, some students get confused. Is it X-linked dominant or X-linked recessive? So answer is X-linked recessive. So correct answer here is A. Let me move on the next question. Which of the following is not a X-linked? It is not a X-linked condition. Which of the following is not a X-linked condition? I am asking not. Now in X-linked, I am considering both X-linked dominant as well as X-linked recessive. So which of the following 4 option is not coming neither in this mnemonic nor in this mnemonic? So in other words, which of the following is associated with autosomes? There are 2 types of chromosomes now, autosomes and allosomes. Allosomes are the sex chromosome, that is X and Y. I am asking which of the following is not X-linked, which of the following is not allosome, which of the following is the autosome. So autosome dominant recessive will work. So you all are right, most of you. So yes, the correct answer here will be A. Okay. So let me show you the mnemonic in dominant. Dominant, it is Duchenne muscular dystrophy. I'm sorry. if you apply the mnemonic, what is the mnemonic of X-linked recessive? It is, I'm sorry, the correct answer is not A. I'm sorry. Let me apply the mnemonics. These are the two dystrophies. Two dystrophies, none of them is the main dystrophy, myotonic dystrophy. So all other dystrophies, Duchenne dystrophy, Emery-Dreifuss dystrophy, these are X-linked recessive. X-linked recessive. So in the mnemonic of Graham Bell, they will come, right? Graham Bell. And this is faciomuscular humoral dystrophy. It is the another name given to myotonic dystrophy. Now you tell me the correct answer. This is the Baker dystrophy. All the four options are on dystrophy. All the four options are on dystrophy. It is a dystrophy, it is a dystrophy, it is a dystrophy, it is a dystrophy. So I have taught you only one dystrophy is autosomal dominant. The name of that dystrophy is myotonic dystrophy. But you will say, ma'am, myotonic dystrophy is not even in the option. Myotonic dystrophy का एक और name है. It is facioscapulohumeral muscular dystrophy. It is the another name given to myotonic dystrophy. Now you tell me the correct answer. Now everyone will be right. So this one is autosomal dominant. Remaining all are X-linked recessive. Now the remaining three, I will show you in the mnemonic of X-linked recessive. That is in Graham Bell. They will come. So Duchenne will come, Baker will come, and Emery will come. Let me show you the mnemonic. This is the mnemonic Graham Bell. Can you see the mnemonic is in front of you? Graham Bell is in front of you. So in this mnemonic, can you see this is Baker? Graham Bell का B है और उसी में Duchenne भी आ गया और Bell का E is Emery. So you can see your remaining three options. Your remaining three options are from X-linked recessive. Have you got it? So remaining three options are X-linked associated. But this one is not associated. Now everyone give me a thumbs up if you got it. Everyone. So it was a tricky question. I guess it was a tricky question. Yes, isn't it? So coming to the next question. The next question is in front of you. Which of the following is showing autosomal recessive trait? Apply the mnemonic. What is the mnemonic for autosomal recessive trait? Autosomal recessive का mnemonic क्या है? What is the mnemonic of autosomal recessive? So A, B, C, D, E, F, G, H, S, P, W. So इनमें से क्या आ रहा है? What is coming in that mnemonic? What is coming in this mnemonic? Who will tell me the correct answer? Who will tell me the correct answer? A, B, C, D, E, F, G, H, S, P, W. S, P, W का S क्या है? What is S in this S, P, W? S, P, W का S क्या है? It is sickle cell anemia. So yes, sickle cell anemia as well as thalassemia, the two types of hemolytic anemia, both are autosomal recessive trait. So the correct answer is not C, no Vibhuti, no Soumya. The correct answer, it is not hereditary spherocytosis. A, B, C, D, E, F, G, H ka H is not spherocytosis. H is hematochromatosis and Hurlers. You are getting confused. So Vibhuti, Soumya, you are getting confused. So H is hematochromatosis and Hurlers. It is not hereditary spherocytosis. Go with sickle cell anemia. SPW ka S is sure short sickle cell anemia. So you should go with sickle cell anemia. So give me a thumbs up if you got it. Give me a thumbs up. So this is how you have to apply these mnemonics. The next question, type of inheritance in MELAS. Do you know the full form of MELAS? It is, what is the full form of MELAS? I will tell you the full form of MELAS. First tell me the correct answer. The four options are in front of you. Is it autosomal dominant, autosomal recessive, mitochondrial or X-linked? Who will tell me the correct answer? Who will tell me the correct answer? Who will tell me the correct answer? Yes. Is it autosomal dominant, recessive, mitochondrial or X-linked? Is it X-linked? X-linked can be anything, dominant or recessive. Yes, very good. Mitochondrial, very good. Very good. Haranpreet, can you tell me the mnemonic for mitochondrial? It is KLMNOP. So KLMN, what is M? M is MELAS. What is the full form of MELAS? MELAS is mitochondrial encephalopathy with lactic acidosis and stroke-like syndrome. That is the full form of MELAS. It is a syndrome. So that is mitochondrial. It is a PYQ. The next question is in front of you. Mitochondrial chromosomal abnormality leads to. The four options are in front of you. Is it labor? Is it Angelman? Is it Prader-Willi? Is it myotonic dystrophy? So who will tell me? Apply the mnemonic for mitochondrial inheritance. The mnemonic is KLMNOP. So apply the mnemonic. KLMNOP में से क्या आएगा? What is the correct answer? What is the correct answer here? The correct answer here is of course A. It is labor. Yes, very good. It is labor. So KLMNOP का L is labor. So question is already asked on labor. Question is already asked on MELAS and question is already asked on Pearson. So you should know the full form. Okay. What is now the next topic, the next mnemonics? So till now we have seen the mnemonics of hypersensitivity, the four types of hypersensitivity. So four mnemonics I have given you for solving many questions on the examples of hypersensitivity. I have already given you the mnemonics of the genetic inheritance. The five type of genetic inheritance we have seen: autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive and mitochondrial. So we have already seen that also. Now tell me genetic inheritance में autosomal dominant का what is the mnemonic? What is the mnemonic of autosomal dominant? Who will tell me autosomal dominant का mnemonic? The mnemonic is dominant itself. D-O-M-I-N-A-N-T. What is M here? M here is Marfan, right? And N here is neurofibromatosis. On these two diseases, many questions are asked in which students usually get confused because there are multiple systems involved in Marfan also, neurofibromatosis also. So next I'm going to give you three mnemonics. One of Marfan and two of neurofibromatosis type 1 and type 2. And then we will solve the polls based on these three mnemonics, one of Marfan and two of neurofibromatosis. Let me start with Marfan. Let me start with Marfan. So what is the mnemonic? The mnemonic is Marfan's itself. The mnemonic is Marfan's itself. Now in this mnemonic, the patient, have you read about the Marfan syndrome? This Marfan syndrome, there is an abnormality in the gene. The name of the gene is fibrillin 1 gene. Fibrillin 1 gene is mutated. That's why the patient have Marfan. The patients are tall. These patients have long fingers. So, okay, there are two heart problems in this patient. What are the two heart problems in this patient? So, let me draw a heart here. So, can you see a heart? Can you see the four chambers in the heart? Imagine this is the left side of the heart and this is the right side of the heart. From the left side, this is the aorta. This is the aorta coming out. This is the arch of aorta coming out of the left ventricle, right? And this is the wall. These are the two walls. This is tricuspid wall and this is bicuspid wall. Now in this heart, am I right? So in this diagram, can you please draw the two abnormalities which occur in Marfan? The first heart abnormality is mitral valve prolapse and the second heart abnormality is ascending aorta aneurysm. So mitral valve prolapse here will be there, and ascending aorta. In the ascending aorta, there will be an aneurysm. You know, ascending aorta, arch of aorta, descending aorta. There are three portions in aorta. So ascending aorta, arch of aorta, and descending aorta. So you can see mitral valve prolapse and ascending aorta. In the option, you will get aneurysm in the arch and descending also. But don't go with those options. Ascending aorta. That's why I'm marking here in the ascending aorta. So these are the two abnormalities in a Marfan's heart. In a patient with Marfan syndrome, you can see the two abnormalities in the heart. Now, if you have drawn in the diagram, you will never forget. So, Marfan ka M ho gaya, M is mitral valve prolapse, and A ho gaya, A is ascending aorta aneurysm. I guess you got it. Now, two abnormalities in the heart, two abnormalities in the eyes. Let me draw eyes. Let me draw two eyes. So, humans have two eyes. So, these are the two eyes. Let me draw two eyes. And this is the nose. I want to explain you something. These are the two ears on the face, right? This is like a face, right? So these are the two. So in the eyes, the nose side, the end at which, so this is known as nasal, and the ears ki taraf it is known as temporal. Okay. So here, the lens got subluxated. The lens in the eye got subluxated. Where it got subluxated? It is superotemporal. So it is superior. So this is the lens of the eye. This is the lens of the eye superiorly and temporally. It is subluxated. So this is the direction. There are various subluxations of the lens. In the ophthalmology, the tutor may have taught you. So it is superotemporal occurs in Marfan. It is not inferotemporal. It is not superonasal. It is not inferonasal. So nasal nahi hai, temporal hai. Temporal mein se bhi it is superior, not inferior. That is my point. So in the option, you will get inferotemporal also. You will get superonasal, inferonasal. So you will get four options like this. Just a second. You will get the question like this. In Marfan syndrome, what is the direction of subluxation of lens? So the four options are in front of you. It is superotemporal, it is inferotemporal, it is superonasal or inferonasal. You got my point. What is the correct answer here? So you can see this is the face, these are the two eyes, this is the lens, this is the nose, these are the two ears. So you should know the basics. The basic is that this is nasal side of the eye, the nasal towards the nose, and this is temporal side of the eye towards the ear. So four luxations are possible. What are the four luxations possible? You got my point. It can be superonasal. This is superonasal, right? This is inferonasal. It is towards nasal, supero and inferonasal. And these two are superotemporal and this one is inferotemporal. So in ophthalmology, you should know various diseases which is causing these subluxation. So currently I am not interested in ophthalmology, all the conditions here. I am interested in one condition only, that is superotemporal. In Marfan, there is superotemporal. So my correct answer here is Marfan, that is superotemporal. Everyone give me a thumbs up. So that is the meaning. That is the first condition in the eye. That is superotemporal subluxation of the lens, which occurs. So S bhi ho gaya yahan pe. One more thing. in eye occurs, it is R, retinal detachment. So the retina got detached here. The retinas got detached, RD, retinal detachment. So 2 in the heart, 2 in the eye. So instead of learning a mnemonic, learn like this. In the diagram, see the 2 things in the heart. Can you see? And can you see the 2 things in the eye? Can you enumerate the 2 things in heart and 2 in eye? What are the 2 things in the heart? See the diagram and tell me. It is mitral valve prolapse. It is ascending aorta aneurysm, right? What are the 2 things in the eye? In the eye, it is superior-temporal subluxation of the lens, number 1. And number 2, it is RD, retinal detachment. So 4 things are done. And tell me the name of the gene which is mutated. It is fibrillin 1. Gene which causes fibrillin 1 protein deficiency. That leads to Marfan, right? And in Marfan, the fingers are long. If you see the fingers of this patient, the patient will have long fingers as compared to normal. The fingers are long. They are very long. It is known as arachidactyly. The word dactyly means fingers. Arachino means long. So it is the long fingers, right? And negative nitroprusside test, it's okay. You can leave it. So that is the full form of the Marfan, right? I will show you the questions in which you can apply the mnemonic and tell me the correct answer. Let me come on neurofibromatosis. Now in neurofibromatosis also students get confused. There are 2 types of neurofibromatosis type 1 and type 2. So let me come on neurofibromatosis type 1. The mnemonic of neurofibromatosis type 1. So okay, the first thing, neurofibromatosis type 1 gene occur on 17 chromosome and neurofibromatosis 2 gene occurs on chromosome number 22. So these 2 are genes present. You have to learn the number of chromosomes. So simple question can be on the number of the chromosome, right? In neurofibromatosis 1, you have again 2 things in the eye. In the eye, there is an optic nerve. Behind the eye, there is an optic nerve. It is optic nerve glioma. Tumor occurs in the optic nerve. And number 2, eye may in the iris, there are nodules in the iris. Those nodules are known as Leishnian nodules. So optic nerve glioma and Leishnian nodules. These are the 2 things which occurs in the eye. Apart from it, patients have 2 things on the skin. On the skin, multiple neurofibromas are formed. In the nerves of the skin, multiple small nodules overall the body, they are formed. These are the tumors of the nerves just below the skin. These are palpable like nodules on the skin. So neurofibromas and capillary spots. I forgot to put the image. These are the brown color spots everywhere on the skin. These are known as capillary spots. So 2 things occurs in the eye. 2 things occurs in the skin, you can learn. And apart from it, 1 in the bone. In the bone, there is sphenoid dysplasia. There is sphenoid dysplasia in the bone. One of the bone got dysplastic, that is sphenoid. Sphenoid bone, you know, sphenoid bone in the skull. That is dysplasia. That is the most common skeletal abnormality. So please learn. And neurofibromatosis 2, learn the mnemonic miss me. M-I-S, miss me. Okay, what is there? There are multiple 3 tumors. Multiple schwannoma, multiple meningioma, multiple ependymoma. Schwannoma occurs in nerves. Meningioma and ependymoma occurs in the brain. Meningioma in the meninges of the brain and ependymoma in the parenchyma of the brain. So schwannoma, meningioma, ependymoma, SME, and these are multiple inherited. So you can learn the mnemonic or learn as it is an SME, the 3 tumors which occurs multiple. So यहाँ पे schwannoma, meningioma और ependymoma multiple होंगे. Neurofibromatosis type 2. In type 1, neurofibromas multiple होंगे. These are the neurofibromas. There is no schwannoma, meningioma and ependymoma in type 1. यहाँ पे न्यूरोफाइब्रोमास मल्टीपल हैं, यहाँ पे ऑप्टिक नर्व ग्लायोमास मल्टीपल हैं, ट्यूमर्स यहाँ भी हैं वहां भी हैं, but the name of the tumors is different. That's why students always get confused. Give me a thumbs up. Now I would like to launch some polls based on Marfan and based on neurofibromatosis 1 and 2. You please answer if you have understood it. You tell me the name of the defect, the gene which is defected in Marfan. Is it fibrillin 1? Is it fibrillin 2? Is it collagen? Is it elastin? Who will tell me the correct answer? Who will tell me the correct answer? Fibrillin 1, 2, collagen or elastin? Who will tell me the correct answer? Yes, you all are right. It is fibrillin 1. Very good, Vibhuti, Soumya, Osama. Very good. The correct answer here is fibrillin 1. So you can see here it is the fibrillin 1 gene which is mutated in Marfan. Marfan ka F, the mnemonic Marfan ka F is fibrillin 1. In Marfan, aortic aneurysm occurs in which portion? It is the PYQ few years back, NEET PG, right? Is it ascending aorta, descending aorta, abdominal aorta or arch of aorta? So which portion? In which portion aneurysm occurs? So aneurysm occurs in which portion? So I have told you in the diagram of the heart, aneurysm occurs. Yes, very good, Vibhuti. The correct answer here is ascending aorta. It occurs in ascending aorta. In the mnemonic also, you can see A stands for ascending aorta aneurysm. So aneurysm occurs in ascending aorta. You got my point? So the most common, can you tell me descending aorta mein aneurysm? Most common cause of descending aorta aneurysm. I'm not asking about ascending. Ascending my answer is Marfan. I also know that. Can you tell me the most common cause of Aneurysm in descending aorta. Who will tell me? Descending aorta may be infrarenal. What is the answer? Can anyone tell me what is the answer? The correct answer in that case will be atherosclerosis. Atherosclerosis is the most common cause of aneurysm in descending aorta, right? Or ascending aorta mein most common cause is not Marfan. Marfan is one of the cause, but most common cause will be syphilis, lutic aneurysm. So in the entire course of the aorta have three portions: ascending, arch, and descending. Descending is also divided into two portions: supra diaphragmatic and infradiaphragmatic, right? The two. So in the infradiaphragmatic, it is suprarenal or infrarenal. So in each portion of aorta, aneurysm can occur. You should know the cause of aneurysm in each portion of the aorta. Sab pe MCQ aata hai. So when I teach aneurysm to the students, I always draw the diagram and tell you various portions mein aneurysm ke what are the causes. So in ascending aorta, there are two causes: syphilis and Marfan. So Marfan causes in ascending aorta, not arch, not descending. Here that is concerned. Okay. Let me come on the next question. The following features of all of the features are of Marfan except. I'm saying except. So which of the following is not a feature of Marfan? Can you read the four options? Can you tell me what is the correct answer here? Which of the following is not a feature of Marfan? Can you tell me? Is it arachnodactyly, which is not a feature of Marfan? Is it reduced joint mobility? Is it dislocation of the lens? Or is it mitral regurgitation, which is not a feature? Who will tell me? Many of you are saying B. Aniru is saying A. Anu is saying D. Why you got confused? So, okay. Arachnodactyly is certainly a feature. The meaning of the arachnodactyly is long fingers, right? Dislocation of lens is certainly a feature. Now tell me dislocation ka direction. The four options are superiotemporal, inferiotemporal, superinasal, inferionasal. So tell me the direction of the dislocation. Who will tell me the direction of the dislocation? It is superiotemporal. Yes, you are right. It is superiotemporal. So this also happens. Arachnodactyly also happens. Dislocation also happens. In the heart, I taught you two things happens. One is aortic aneurysm, aorta ka ascending aorta ka aneurysm. What is the second thing? It is mitral valve prolapse. Have I taught you? In the diagram also I drawn mitral valve prolapse. Mitral valve prolapse leads to mitral regurgitation. Now, so mitral regurgitation is also a feature. So you have to apply the knowledge. It is not only ratification ki ma'am you taught us only mitral valve prolapse. You have not taught us mitral regurgitation. So obviously mitral valve prolapse will lead to mitral regurgitation. There is no need to say this. So it is also a feature. But it is not reduced joint mobility. It is the increased joint mobility which occurs in Marfan. In Marfan, the joints are hypermobile. There is increased joint mobility. It is one of the feature of Marfan. So the correct answer here is B. You got my point? So it is the increased joint mobility, not the reduced one. Anyway, the next difficult and not difficult but tricky and confusing topic is the two syndromes or diseases written in front of you: Prader-Willi and Angelman. So it is very easy once if you got the concept. Now otherwise students always get confused in that. Okay, let me draw a human cell. This is a human cell, any human cell, a diploid cell. And inside the human cell, this is the nucleus. In the nucleus we have 23 pairs, 46 or 23 pairs of chromosome. This is pair number 1, this is pair number 2, pair number 3, pair number 4. Likewise, we have total 23 pairs. Agreed? Yes, everyone agreed. Now listen my point. In each pair, one chromosome is from mother and one chromosome is from father. So in pair number 1, so this fetus is formed by the fusion of ova and sperm. Ova is haploid, sperm is haploid. When they fuse in fertilization, the zygote is formed. So zygote is diploid. It is formed by the fusion of ova and sperm. Ova contain 23 chromosome, not 23 pair. Sperm also contain 23 chromosome, not 23 pair. When they fuse, chromosome number 1 of both of them occur together. 2 occur together, 3. So in this way, a diploid zygote is formed. And from the zygote, fetus is formed. From fetus, embryo is formed. From embryo, child is formed. From child, every human being is formed. So every human being have 23 pair, one from the father, one from the mother in each pair. You agree? Okay. So one is maternal from the mother, one is paternal from the father in each 23 ki 23 pair mein each of the chromosome, each pair, one from the mother side, one from the father side. Yes, you know that. Now I am interested in pair number 15 only. So I am drawing pair number 15. I am not interested in all. So this is pair number 15. Pair number 15. So in pair number 15, what you are expecting? Here you will say, ma'am, in pair number 15 also, one should be from the mother and one should be from the father. Yes, paternal, one is maternal. So this is normal. This is normal. But in some people, what happens? There is an abnormality in chromosome number 15. If the paternal is deleted and maternal is duplicated, what I am saying? Listen my words carefully. Paternal deleted. Paternal is deleted. There is no chromosome number 15 paternal. and the maternal one is duplicated or imprinting. It is known as maternal imprinting or duplication. So maternal become double and paternal. So there is no father ka contribution in chromosome number 15. Only maternal become double. So this disease also is known as Prader-Willi. Prader-Willi. So what happens in Prader-Willi? You can say two things happens in Prader-Willi. Number one, paternal chromosome number 15, it is deleted and the maternal will become double. That is disomy or imprinting. Yes, Vibhuti, disomy or imprinting occurs of maternal. So you will get 4 confusing options. In Prader-Willi, is it paternal deletion, maternal disomy, or maternal deletion and paternal disomy? So you should know. So learn like this, P for P. Paternal is deleted in Prader-Willi and the other one will be, of course, duplicated. Now the reverse can happen. Sometimes the maternal one is deleted. The maternal one is deleted and the paternal will become double. So the disease is known as Angelman. This disease is known as Angelman syndrome. Give me a thumbs up. In Angelman, the maternal is deleted. So learn like MA. It is PP. Learn the deleted one. The other one obviously will become disomy, will become imprinting. Don't learn the double, which is duplicating. Don't learn that. Learn which is deleting. So in P, Prader-Willi, paternal is deleted. In Angelman, the mother is an angel, na? Mother is like an angel. So in the Angelman, the maternal one is deleted. So learn like that. The other one will be imprinting or disomy will be there. Now you will never forget. So let's show you the diagrams for these, and then I will come on the clinical features of these two syndromes. So the problem is on the chromosome number 15. Prader-Willi and Angelman, these two are distinct genetic disorders. Both of them, the mapping on the chromosome is the chromosome number 15. So you can see this is normal. You can see the 3 diagrams. See normal. In normal, one is maternal. This is maternal copy. This is paternal. So chromosome number 15, one is maternal, one is paternal. So in all of us, inside normal human being, chromosome number 15, my chromosome number 15, your chromosome number 15, one is from mother, one is from father. It is normal. But in some person, you can see the paternal copy is deleted. The paternal one is deleted and maternal one will show the disomy. It is known as Prader-Willi. In some of the persons, the maternal copy is deleted. You can see the maternal copy, it is deleted and the paternal one will show disomy. It is known as Angelman. Everyone give me a thumbs up. Happy puppet, yes, Vibhuti, I am coming on that. Wait a while. Everyone give me a thumbs up. You got this point? So the summary is written in front of you. Can you see the summary? What is the summary? The summary is written in front of you. Can you tell me what happens in Prader-Willi? In Prader-Willi, paternal deletion, maternal imprinting or maternal disomy. So imprinting, disomy, maternal hogi, paternal deletion. And in Angelman, the maternal deletion and paternal imprinting and disomy takes place. Everyone give me a thumbs up if you got it. Everyone first give me a thumbs up, then only I will proceed ahead. First, everyone give me a thumbs up. You got this point? Yes? Yes? So, okay. Yes, mother is like an angel, Vijay. You can learn like that. So, in Angelman, the mother is like an angel and the mother one is deleted only. So, Angelman ne mother ko hi delete kar diya. Right? And Prader-Willi, P for P. Prader-Willi mein paternal ko delete kar diya. Right? So, which one is deleted? Learn that. The other one is automatically disomy or imprinting. So, if you try to learn both now, you will get confused. So, how I learn P for P? In Prader-Willi, paternal is deleted. The other one is duplicated. In Angelman, with Angel, I remember the mother. So Angelman in the maternal is deleted. The other one is obviously duplicated. So that is how you have to learn. Now let me come on the clinical symptoms of the two child. Can you see two child in front of you? The two diagrams in front of you. This is Prader-Willi syndrome. This is a child with Prader-Willi syndrome. You can see a girl. The girl is obese, overweight, right? You can see a girl here. So she is lean, thin, and this is Angelman syndrome. Let me tell you other symptoms also. So actually it is not the complete 15 chromosome which is deleted and which is showing the imprinting and disomy. It is a fragment. It is a genomic fragment. This is the exact fragment. Don't learn the sequence. Now learning the number of chromosome is more than sufficient. Right? Okay. So let's move ahead. These are the clinical features of Prader-Willi. For Prader-Willi, I am having a mnemonic for you. The mnemonic is Pradeep Madhosh. M-D-H-O-S-H. Pradeep Madhosh. So Pradeep Madhosh is a mnemonic. If someone is named Pradeep here, don't take it otherwise. So Pradeep Madhosh is just a mnemonic. Pradeep, you will learn. I'm talking about Prader-Willi. Pradeep is just to remember you Prader-Willi. Madhosh is the mnemonic actually. Right? Actually mnemonic is Madhosh. It is not Pradeep. Pradeep se tumhe yaad aayega. I'm talking about Prader-Willi. M. Madhosh ka M is mentally retarded. So the person with Prader-Willi is mentally retarded. Right? It is diminished fetal activity. When such child is a fetus inside the uterus of the mother, the fetal activity is very diminished. It is hypoactive. Because of the hypotonia, the child is hypoactive and it is showing minimum fetal activity. So fetal activity is not felt by the mother, rarely felt, hardly felt by the mother. The child is obese. I have told you in the diagram also, this child, see, she is an obese girl. She is mentally retarded. She is mentally retarded. She is obese, and when she was a fetus, she was having very little fetal activity and she is hypotonic. She is very hypotonic. The tone in the muscle is less. That's why fetal activity is less. Short stature. Now here the height is not shown, but this girl is short stature as compared to the peer group. This girl is short stature, definitely. And hypogonadotropic hypogonadism. So this girl is infertile because of hypogonadotropic hypogonadism. You know the meaning, I guess. So that is the meaning of Madhosh. MDHOSH. OSH. Yes. So the mnemonic is in front of you. Everyone give me a thumbs up. Everyone give me a thumbs up. Right. So let me move ahead. Angelman syndrome. There is a mnemonic happy puppet. Happy puppet Shima. Actually, the mnemonic is Shima. The mnemonic is Shima. But this girl, this child, just a second. This child is always remain very happy and always you see the laughing face. Can you see the girl is laughing here? So always they smile. Always they are very happy. Always. Without any reason, they just smile. They just laugh. So that's why these are known as happy puppets. These are known as happy puppets. So happy puppet is just to learn. These are always happy. They always have excessive laughter. So the mnemonic is Shima. Happy puppet Shima. As for seizures. So this child always has seizures. Hypotonia is a common feature for both. For Prader-Willi also, for Angelman also. It is inappropriate laughter, I say. Happy puppet. That's why they always laugh. You can see the girl is laughing here, right? She is not mentally retarded, but she has seizures. So in the brain, here you have mental retardation and here you have seizures. So in the brain, you have one mental abnormality. There is mental retardation, there is seizures. That girl is obese, that girl is thin. Both are hypotonic. Both are hypotonic. She is not laughing too much, but she always laughs. She is happy puppet. Give me a thumbs up. Give me a thumbs up. One more thing. Okay, I'm sorry. Mentally retarded are both of them. I'm sorry. Forgive me for that. Ataxia. Ataxia is a feature. So Shima. Learn the full form of SHIMA. So let me summarize. Let me give you the summary. I am done. I will launch the polls now based on these. So I taught you two syndromes. One is Prader-Willi. One is Angelman syndrome. Give me a thumbs up. I taught you this. So first tell me what is the problem in each of them. In each of them, the problem is common. The problem is chromosome number 15. In Prader-Willi, the paternal copy is deleted and the maternal copy is showing imprinting or disomy. Whatever you say, the same thing, it is duplication, disomy or imprinting. Here in Angelman, the maternal copy is deleted and the paternal one is showing duplication. That is either you say imprinting or you say disomy, whatever you say. Give me a thumbs up. That is the problem. Now, who will tell me the mnemonics for their clinical symptoms? So in Prader-Willi, it is Pradeep Madhosh, MDHOSH, right? And here it is happy puppet Shima, SHIMA. If you don't want to learn happy puppets, it's okay. Madhosh and Shima, that is the mnemonic. So mental retardation is common in both of them. Number one, hypotonia is common in both of them. So two features are common. Just mark them first. So mental retardation, you can see it is common. M is common in both of them and H is common in both of them. Mental retardation and hypotonia is common in both of them. Apart from it, you know the mnemonic. और क्या था? Here it is hypogonadotropic hypogonadism. So the patient is infertile, the patient is obese, the patient is showing hypotonia and diminished fetal movements. Diminished fetal movements. ये S क्या था? What was S here? I just forgot. What was S in Prader-Willi? What is S here? Here S is seizures. I know here S are seizures. It is inappropriate laughter. Inappropriate laughter means it is happy puppet and it is ataxia. It is ataxia. I just forgot S here. Can anyone help me in reminding? S क्या था Prader-Willi में? Okay, yes, short stature. Very good. It was short stature. Very good, Vibhuti. It was short stature. So this girl is short, but this one is not short as compared to peer group. So let me launch some polls based on these two confusing syndromes. You can say genetic abnormalities. Okay. Read the question. Tell me the correct answer. One of the following disorder is due to maternal disomy. I'm asking maternal disomy of chromosome number 15. I'm asking maternal duplication, maternal disomy, maternal imprinting. Kisme hoga? In which of the following will occur? So you got confused. Haranpreet, you got confused. You got confused. What about others? Can anyone want to tell me the correct answer? Don't rush. Don't panic. Just take a deep breath. Have a thought. Give a while. Think the question and then tell me the correct answer. So yes, Vibhuti, Anu, Lavanya, you also got confused. Lavanya, you also got confused. Anira, you are right. So, okay. I'm asking the maternal one duplicated. I'm asking maternal. The mother is duplicated, so the father is deleted. Maternal is duplication means the maternal duplication kab hoga? When maternal duplication will take place. Mother will duplicate when the paternal one is deleted. So in other words, I am asking paternal deletion kisme hoga. So the correct answer is Prader-Willi. The correct answer is Prader-Willi. The correct answer is not Angelman. So many of you got confused. So Osama, Lavanya, Haranpreet, I guess you got confused. Give me a thumbs up. Now give me thumbs up. Lavanya, you got it? You got it now? So the correct answer is Prader-Willi, not Angelman. So don't get confused. Even you know the answer, sometimes you do silly mistakes in the exam. So don't do that. You got my answer? So the correct, it is not B, I'm sorry. The correct answer here is A. The correct answer here is A, right? So always remember, yes, Vibhuti, always remember which one is deleted. So you will never get confused. So correct answer here is A. Here I have written wrong. The correct answer is A. Tell me the next question. Paternal chromosome 15 deletion occurs in. So it is a straightforward question. I'm asking paternal deletion. I'm asking paternal, I'm asking deletion. Paternal deletion occurs in. So everyone will be correct, I guess now. It is a straightforward question. There is no confusion. Yes, Suman, simplified, Vipul, very good. So the correct answer is straightforward. The answer is Prader-Willi. So straightforward. So examiner have asked you the same question in two different ways. In the first question, the examiner asked you maternal disomy. So answer is Prader-Willi. And in the second question, the examiner asked you paternal deletion. So again, the answer is Prader-Willi. So you can see how beautifully the examiner is changing the question to change the answer. Give me a thumbs up. Obesity with mental retardation is seen in which of the following syndromes? So 4 options are in front of you. Is it Prader-Willi? Is it Turner? Is it Fragile X? Or is it Noonan? So obesity with mental retardation. So apply the mnemonic Madhosh. So Madhosh will be the mnemonic. Madhosh mein H-O. O is the obesity and Madhosh ka M is mental retardation. So it occurs in Prader-Willi. It occurs in Prader-Willi. Obviously the correct answer here is A. So you have to apply the mnemonic. So let me move ahead. Angelman syndrome is due to. You tell me the correct answer. What is the main cause of Angelman syndrome? Is it diagenic inheritance? Is it inversion? Or is it uniparental disomy? Uniparental disomy of some of the chromosome, or is it mitochondrial disorder? What you will say? Apply your knowledge. What happens in Angelman? In Angelman, the maternal one is deleted. So what will happen to the paternal one? Only paternal one is there. For chromosome number 15, a segment, a genetic segment of chromosome number 15, paternal duplication occurs. Paternal. So can I say it is uniparental disomy? The uniparent here is the father. That is paternal. So it is paternal disomy, uniparental. There is no mother contribution here in chromosome number 15, a segment of chromosome number 15. So yes, you all are right. The correct answer here will be C. That's how the correct answer becomes C. Give me a thumbs up. So correct answer here is C. Now the next mnemonic. Have you heard about Mallory-Dank bodies in pathology, in systemic pathology? Where you have heard? Can you tell me the list of the diseases where Mallory-Dank bodies occurs? Can you tell me someone? कोई एक भी नाम पता है? So there is a list of diseases in which Mallory-Dank body occurs. Can you tell me a list? Anyone? Anyone? Not the list. If you know any single cause, you can write in the chat box. Anyone of you? Anyone of you? So there are, okay, it occurs, of course, it occurs in cirrhosis. Mallory-Dank bodies occurs in liver, inside the hepatocytes of the liver. So liver are made up of cells. The cells of the liver are hepatocytes. Inside the hepatocytes, in the cytoplasm, we found certain bodies, the eosinophilic dark pink color bodies inside the hepatocytes of the liver in the cytoplasm. These are known as Mallory-Dank bodies. It is seen in certain cirrhosis. So tell me the name of those cirrhosis. कौन से cirrhosis में होगा? So it is a big list. So the mnemonic is in front of you. The mnemonic is Indian child will have alcohol at primary bill. So it is a mnemonic. If you like it, you can learn. Otherwise, learn the list as it is. But you have to learn the list for Mallory-Dank bodies. Okay. So see the mnemonic Indian child. Here in this mnemonic, Indian child stands for Indian childhood cirrhosis. The first type of cirrhosis, Indian childhood cirrhosis. Will, say Wilson cirrhosis. The cirrhosis in Wilson's disease. Wilson's disease is copper excess in the liver, which leads to cirrhosis, which leads to injury to the liver and cirrhosis. Have is not a cirrhosis, it is hepatocellular carcinoma, the liver cancer, the most deadly cancer, liver cancer, hepatocellular carcinoma. Alcohol, say alcohol cirrhosis, alcoholic cirrhosis, the most common cause of cirrhosis. The 70% cirrhosis is due to alcoholism only. So alcoholic cirrhosis. At it is antitrypsin. Antitrypsin deficiency also lead to cirrhosis. You may be knowing that the various types of cirrhosis, right? And primary bill. primary bil is primary biliary cirrhosis. There are two types of cirrhosis, primary biliary and secondary biliary. Secondary biliary don't have Mallory-Dank bodies. Please take this point in your mind. Take this in consideration and mind this point. It occurs in primary biliary cirrhosis, not in secondary biliary. Give me a thumbs up. So you can see 1, 2, 3, 4, 5, 6. These are the 6 conditions in which Mallory-Dank bodies occurs. So what is the mnemonic? Can anyone of you can tell me the mnemonic? So the mnemonic is Indian child will have alcohol at primary bil. So separate them like this. Indian child will have alcohol at primary bil. Now tell me the full form. It's very easy, I guess. Everyone can tell. Indian childhood cirrhosis, Wilson's disease, hepatocellular carcinoma, alcoholic cirrhosis, antitrypsin deficiency cirrhosis, and primary biliary cirrhosis. Everyone give me a thumbs up. Everyone give me a thumbs up. Okay, let's apply this knowledge in a question. To maza aayega, right? So let me show you a question. Just a second. See this question. Who will tell me the correct answer? Read this question. Please read this question. Mallory hyaline bodies are present in all of the following except. So which of the following doesn't have Mallory hyaline body? Read the 4 options are in front of you. Apply the mnemonic. The mnemonic is Indian child will have alcohol at primary bil. So these are the 6 conditions. So can you see in this condition? Apply the mnemonic. So primary biliary cirrhosis is this one. Yes, it is coming in the mnemonic. Indian childhood cirrhosis. Yes, it is also coming in the mnemonic. Alcoholic cirrhosis. Yes, it is also coming in the mnemonic. But what is not coming? Secondary biliary cirrhosis. So it is very obvious and a very easy question. So the correct answer here is B. But many questions asked on Mallory-Dank bodies in your exam. So you should know this mnemonic. Give me a thumbs up. The next mnemonic I am moving ahead. Okay, one more on this. Okay, solve this also. Mallory hyaline bodies are seen in. It is a previous year question paper from JIPMER, from one of the paper of JIPMER, I guess. So Mallory hyaline bodies are seen in. So the 4 options are in front of you. Apply the mnemonic. Indian child will have alcohol at primary bil. What is coming here? So is it hepatitis C coming in this mnemonic? No. Amoebic liver abscess coming in this mnemonic? No. Autoimmune hepatitis coming in this mnemonic? No. Yes. So the correct answer again C, it is Indian childhood cirrhosis, which is coming in this mnemonic. So if you know the mnemonic now, you can apply it very instantly and the answer will be in front of you. Now in your exam, the time is a limitation. You don't have the entire day to write your paper. You have nearly 40 to 45 seconds for one question, right? In INICT, time is very less. You may be knowing the time is very less. You just have 180 minutes for 200 question. You yourself do the calculation now. 180 minutes for 200 question. Apply one question, not 1 minute, less than 1 minute. So it is almost 40 seconds for 1 minute. In NEET PG, okay, you get 1 minute for one question. You can say that. But here it is not the case. So the time is the limitation. So mnemonics will help you to reach to the answer very instantly. So very instantly you just apply the mnemonic. If you know the full form, look at the 4 options. What is coming in that mnemonic? Go for that. So this is how you can be correct and you can be fast, right? So you have to be fast and you have to be accurate. Both the properties will help you to gain a single digit rank or a good rank, a decent rank in your exam. So you should be both. You should be fast and you should be accurate. Some people are very fast, but they do silly mistake. So they will not win. Some people are accurate, but they are very slow. They just think and mark few questions only, but they are correct. They also not win. You have to have both properties if you want to get a good rank in your exam. Fast and accurate, right? So anyways, let me move ahead. Next, flea-bitten kidney. Have you heard about flea-bitten kidney? What is flea-bitten kidney? Can you tell me what is flea-bitten kidney? So on the surface of the kidney, humans have a pair of kidney. It is our excretory organ. We know that in some diseases, on the surface of the kidney, we get red color, small hemorrhagic, you can say patches or spot. The entire kidney have red color, small hemorrhagic patches or spot. So it is looking that the insect known as flea have bitten the kidney all over. You know, if mosquito bite is there, we have a small red color spot nodule at that point. So it is like the flea have bitten the kidney entirely over. It is a diffuse disease. So tell me name of conditions. Yes, very good. Vibhuti, malignant hypertension is one of them. Very good, very good. RPGN, good posture, Suman. Okay. Few of the options are correct. You are telling me. Tell me other options. Flea-bitten kidney के और क्या-क्या हैं? ये बहुत common question है. Flea-bitten kidney is seen in which of the following or which not of the following? So there is a mnemonic. The mnemonic is we hate PSM. PSM is a very important and good subject. Don't hate it, right? So it is just a mnemonic. We hate PSM. So W stands for Wegener's granulomatosis. Hate, it stands for HS purpura. Hate stands for HS purpura. P stands for polyangiitis. S stands for subacute endocarditis and M stands for malignant hypertension. Malignant. इसमें you add one more RPGN. You add not RPGN. No, RPGN is not a cause. No, RPGN. AS, yeah. क्या कहते हैं इसको? Post streptococcal glomerulonephritis. You can add PSGN. So polyangiitis के साथ you can add one more PSGN here. PSGN here. Give me a thumbs up. Everyone give me a thumbs up. So let's move ahead. If you have learned this mnemonic, so we hate PSM. Everyone give me a thumbs up. What is the full form? Who will tell me? We hate P. There are two P. S, M. Tell me the full form. This is flea bitten kidney. Flea bitten kidney. Vagus granulomatosis, HS purpura, the two P's, polyangiitis and PSGN. Polyangiitis and PSGN. S is SABE, subacute endocarditis. SABE and ABE. The two type of endocarditis is not acute, it is subacute one. And malignant hypertension. It is not benign hypertension. Please mind it, it is the malignant one which is having flea bitten kidney. So let's move ahead. Let's move ahead and apply this mnemonic in some of the question. Flea bitten kidney is seen all of the following conditions except. See the question except. अच्छा H एक और ऐड कर लो. HS purpura के अलावा HUS. HUS भी ऐड कर लो here. Add HUS. HS purpura के अलावा hemolytic uremic syndrome. You will find flea bitten kidney. Now apply your mnemonic. We hate PSM. PSM का M is there. PSM का S is there. And hate का H is there. But diabetic nephropathy is not a cause of flea bitten kidney. That's how this is our correct answer. And you all are right. Very good. The correct answer here is D. So this is how you have to apply your mnemonics. Coming on the next mnemonic, what is Lafrani syndrome? What is Lafrani syndrome? You know, humans, again and again I am telling you, have 23 pairs of chromosome. So this is pair number 1, pair number 2. I am interested in pair number 17. This is pair number 17. On pair number 17, we have a gene. The name of the gene is P53, which is our molecular police guard. This is P53. We have two copies of P53. We all have two copies, one from the maternal, one from the paternal. They are present on chromosome number 17. So it is our DNA repair gene. It is the molecular policeman. So this is the mechanic. You know, the cell is like a car. So in the car, we have accelerators. The accelerators are proto-oncogene. We have brakes. The brakes are like tumor suppressor genes. So whenever accelerator and brakes, they got defective, accelerator overactive and the brake is failed, it can lead to cancer. So these are the mechanics, these are the molecular policemen, these are the guards of the genome. These are DNA repair gene. They will repair, they will do the repair of the accelerators and brakes, that is proto-oncogene and tumor suppressor gene. But what if the mechanics are dead? Out of the two mechanic, if one of them is dead, the syndrome is known as Lafrani syndrome. Now you will never forget. So Lafrani syndrome is a syndrome in which one of the copy of P53 gene is mutated. So this person is highly prone of having cancers in future. So which cancers of the body can occur? Which organ cancer occur in Lafrani? So the person is prone of having multiple cancers. So in one life, he can have 5 cancers in one life. Name the 5 cancers. There is a mnemonic for that. The mnemonic is Sabbal. S for stomach cancer, the 2B, brain and breast. If the female is there, breast cancer, brain cancer, A for adrenal and L for lung. In the lung, we have 4 types of cancers: squamous, adeno, small cell, large cell. So whenever you say lung cancer, being an MBBS student, now it's not wiseful to say only lung cancer. Which type of lung cancer? So always subclassify. It is squamous type of lung cancer. So don't only say lung cancer. You will get all 4 options of the lung cancer. So lung cancer it is squamous, not adeno, not small cell, not large cell. So being specific, the mnemonic is Sabbal. So this person with mutated P53 gene, he will have 5 cancers in the life. The mnemonic is SBBAL. You can make some other mnemonic also. Okay. So you can make BALS, BALS. Okay. Whatever mnemonic you like, learn that. So these are the cancers which can occur in Lafrani syndrome. I'm having multiple more mnemonics with me, multiple myeloma, free radical scavengers, many mnemonics. The mnemonics are endless. मैं 3 घंटे भी पढ़ाती रहूंगी तो it will not end. So it's time to end this class and start another class. So the next class is pharmacology mnemonics, right? It is more interesting than this class, believe me. So give me a break of just 10 minutes. I'm ending this class. Just a second. I'm just ending this class, and after that, join me back for the next class after 10 minutes. So it's at sharp, just a second, at sharp 9 o'clock, join me for the next class, that is pharmacology mnemonics. Learn with fun pharmacology mnemonics, mnemonic marathon. So in which I will tell you multiple mnemonics in the entire pharmacology. I will start with general pharmacology and then I will move on systemic pharmacology. The lecture will be big. It will be a 2-hour lecture. So don't dare to miss my next lecture, pharmacology mnemonic, just after 10 minutes. Give me a break of 10 minutes. In 10 minutes, after 10 minutes, I will join the next link, pharmacology wala link. Click on the link on YouTube only. It is a free lecture which is available on the YouTube only. So thank you very much for being with me for this lecture. And these are the free classes. You can imagine if on Unacademy, the free classes are so informative, they are so knowledgeable, how the plus or paid subscription will be. So on Unacademy, we have 3 types of paid subscription. For the newcomers who don't know, I'm telling for them, there are 3 types of or 4 types of paid subscription. So in plus subscription, you will get only Unacademy. In iconic subscription, along with Unacademy, you will get Prep Ladder also. And in light subscription, you will get only test series, right? The various plans are available in front of you. You can see the prices also. Longer the plan, cheaper it is, right? So if you're a first drop, second drop student, my advice for you, go with a 4-year, 3-year, 2-year plan. Per month wise, it will be more cost effective for you. But if you're not sure whether you want to continue with such a long time with Unacademy or not, so give a trial for 2 months. So you will not be disappointed. That is my challenge, right? So take a trial for 2 months. If you like it, you can extend it. If you don't like it, so what, right? So give it a trial. At least give it a trial. For the plus also, for iconic also. If you want only test series, go with light subscription. If you are a first drop student, you take plans only for first drop, in which you will get classes for anatomy, biochemistry and physiology only, not for other subjects. So various plans, they are very, very cheap. You can see cheap, they are very cheap. So you can of course you can afford it and you can go with these plans, right? Whatever plan you are purchasing, before payment, apply my code Sachdev10, SACHDEV. That is my surname, Dr. Priyanka Sachdev, SACHDEV, Sachdev10. Without space, it is 10. So Sachdev10. If you apply this code before payment on purchasing of any of these plans, you will get straightforward 10% discount, the authentic discount, the maximum discount team can offer you. So that is for sure. So thank you very much for being with me. I would like to stop here and rejoin just after 10 minutes at 9 or 9:05. I will rejoin for pharmacology. So be with me. I want everyone to come back. Thank you very much. I'm ending this lecture and stay connected for the next lecture. Okay. Thank you.